Mr. Berry. My name is Stacy Kelly, and I'm going to be your nurse today.
All right, it's nice to meet you.
Thank you. Nice to meet you too. So I noticed that in your chart here it says that you have been feeling very tired lately, and I'm thinking it sounds like you're suffering from sleep apnea. Do you know what that is?
No, what is sleep apnea?
Well, sleep apnea, it's a common disorder where you usually take pauses and shallow breaths while you sleep, and they can last from a few seconds to a few minutes, and they often occur 5 to 30 minutes or more an hour, and then typically you start breathing normally again, but usually that's with like a loud snort or choking sensation feeling. And it's a chronic condition that disrupts your sleep. So often you kind of move in and out of deep sleep to a light sleep, and when your breathing pauses, it becomes shallow, and then this results in poor sleep quality. So generally you will notice it most from daytime sleepiness, and so you're sleepy a lot during the day. But the good thing is that once we diagnose you, the doctor diagnoses you, and it's easily corrected.
Okay, how can I be diagnosed?
Well, you would have to have a sleep study done, and this is where your doctor sets this up and measures how long you're sleeping, and they hook you up to monitors and such, and the monitors record different things like your breathing, your blood oxygen level, and your REM sleep stage.
What is REM sleep?
REM sleep, the body repairs and regenerates tissue, builds bone and muscle, and your immune system. And so if you never get to those deep stages of sleep, then you always feel tired because your body is basically not regenerating and doing those things that it needs to do to feel rested and regenerate itself.
When can I get a sleep study done?
Well, I will get with your doctor, and I will have to talk to him, and basically he will set up a date and time. In the meantime, I can grab some things that will that I can go over with you that will help until he gets that set up and everything. Additional things that help so that you can be working on those as well, that just kind of correlate with what he will provide for you.
Okay.
And so I'll be right back.
Okay.
Hello, Mr. Berry.
Hello.
Okay, I'm back. I grabbed one of our posters here in the office, and I'm just going to hang it here and kind of go over a few things with you that I can explain before you speak with the doctor and all. And this just kind of gives you an idea of some of the things that I'm going to discuss with you. And the first thing that I noticed in your chart is in the past 5 years, there's been some weight gain, about 50 pounds. And so that's kind of a thing. If you could maybe try to go on some kind of diet to try to lose a little bit of weight. I know that has an influence in how you sleep and your daily activities. Also, you're a smoker, correct?
Yes.
Smoking has a lot of side effects to it, just very similar to caffeine. Smoking, nicotine and caffeine kind of go together as far as how they affect our breathing habits and daily activities, and then as we sleep and all. So they have the the bad side effects that affect that, as well as are life threatening. So if you are interested in quitting smoking, that would make a dramatic difference and would improve the sleep apnea as well. Do you generally eat pretty heavy meals? I mean,
Yes, even at night.
okay. Yeah, heavy meals are, along with caffeine and smoking, are the three biggest, what we consider, risk factors, or don't help the situation. So here we have listed the coffee, the caffeine, the smoking, and the heavy meals. Any of those, however you can cut back, small differences will make a difference. And even alcohol. Alcohol plays a big effect in that as well. And a lot of people say that they will drink alcohol or take sedatives, thinking that that's going to actually help their sleep pattern, but they generally have the reverse effect, especially long term. So they make you sleepy, but they make it harder for your throat to stay open while you are sleeping. And so they might help you generally fall asleep fast, but they really interfere with staying asleep for a long period of time and getting a good restful sleep. So those things you want to avoid, and especially avoid in the evening times. And try to maintain a regular sleep pattern, so that your body is used to, routine and specific things at specific times. And while you're sleeping, it's better for you to try to sleep on your side, like as we have this picture here showing. Oftentimes it's better to be in a more comfortable position like that, and as far as breathing goes and everything, it's better to sleep on your side instead of your back, as far as keeping your throat open as well. And if you have a hard time sleeping on your side, you can use pillows and kind of at a 45-degree angle and to prop on, just as we have in that picture there. So those are things that will help. And you can place strips, over your nose, the Breathe Rights, nasal sprays, allergies, if you find that you have any kind of allergy problems, anything to keep your airway clear will help as well. So over the counter they have the nose strips and the nasal sprays and things like that. So you might want to try those as well.
Okay. That's a lot to remember. I just hope I can remember it all.
Well, I'm glad that you mentioned that, because I have this, but I brought you some brochures too, because it is a lot to remember. And so I brought these so that you can take these home with you and look over them, and it just reinforces the things that I told you, and that way you can refer to that, so that you don't have to try to just remember it all. You have something visual to look at.
Okay, thanks. That'll definitely come in handy.
Well, do you have any questions about anything in particular?
Well, if I do all these things, will it cure my sleep apnea?
Those are just things that will help, that will go along, with what the doctor will provide for you. They just come in handy, but it won't completely cure it. These things just improve it. There is one more thing I would like to tell you. The medical treatment that the doctor will give you is actually a piece of equipment, and so that's the crucial part of it. That's the main thing that you're going to be using for your sleep apnea. All of these things just make it, just correlate with it to make it more effective.
Mm-hmm.
So let me show you how to I actually have it set up right here. This is what we call the CPAP.
What is a CPAP?
Well, the CPAP is the machine that it's prescribed for your doctor for sleep apnea. It fits over your nose and it gently blows air into your throat. And so this is what you sleep with at night. And the air presses on the wall of your airways and it's adjusted so that it's just enough to stop the airways from being narrowed or blocked during sleep. And usually a technician will come to your home and bring you this equipment, and they will set it up for you based on your doctor's prescription. And after the initial setup, you may need to have the CPAP adjusted on occasion for the best results.
Okay.
And so basically, this is it. What you're going to do is you're going to take your water and you're going to fill it up to the fill line right here. And then you're going to hook your hose to it right here. And then you will press and hold for a few seconds on the on button, and immediately it turns on, and this is the device that you will be placing over your head and into your nostrils.
Okay.
So that's how it works. It's fairly easy, just water and then turning it on, hooking it up, turning it on, and this is what you will sleep with. This will stay on all night long, and it's just a continuous flow of the air so that you don't have that interrupted breathing, pauses in breath or not breathing. And so that's how that works.
Okay. So let me get this right. So I'll pour water into the machine. And then hook the hose on the machine, is that right?
Yes. Just like that.
Okay. Now turn it on.
Yes.
It's already preset.
Yes.
Okay.
We'll place that on your...
Like that?
Yes.
Good.
Can you...
I feel it
You can feel
blowing
how...
the air. Okay.
Yeah, that's exactly how it works. So that's what you will try to avoid these things. Do the routine things that you can to go along with this. And then right before you go to bed, this is the procedure you will do. And this is what you will use all night. Okay, so I hope I didn't hurriedly go over everything with you. Do you feel like you understand and have a good idea about the sleep apnea and what the doctor will have you do?
I think I do. I'm ready to schedule a sleep study.
Okay. I'm going to go talk to your doctor right now, see
Okay.
when we can get that set up, and I'll be right back. Okay, I just spoke with your doctor, and he has set that up at Nacogdoches Memorial Hospital to have the sleep study done Monday at 7:30 p.m. Will that work for you?
That'll work fine.
Okay, here is a reminder. That's your appointment date and the time and at NAC. And if that's it, I guess we can go to the front desk and get you checked out.
Okay.
Okay, thank you.
Thank you.